People over 70, itching in these three strange locations may predict a shorter lifespan. People over 70 who experience itching in three locations on their body may be at risk of a shortened lifespan. These symptoms are not just signs of normal aging, but can be a warning of serious health problems, increasing the risk of disease and accelerating the body's decline. Persistent itching in certain areas of the body may be associated with a shorter lifespan, especially in the elderly. This is a discovery that not everyone knows, but is extremely important, especially when we begin to enter our old age years. As a nutritionist and geriatrician, I always want to share valuable information so that everyone can better understand their bodies, especially the warning signs that we should not ignore. Itching may be just a minor symptom, but for the elderly, it can be a sign of deeper problems. Persistent itching in certain areas of the body can be a sign of changes in health, related to chronic diseases, even blood circulation or skin disorders. This is especially worrying when it occurs in people over 70 years old, because the body is now showing signs of decline, and if not cared for promptly, life expectancy can be shortened. Therefore, when there is any feeling of itching that lasts or appears in areas such as the legs, back or abdomen, you should not take it lightly. Pay attention, monitor and have regular checkups. Timely attention can help you detect hidden health problems, from which you can take appropriate treatment and care measures to improve your quality of life and prolong your life. As seniors, we deserve to live healthy and happy lives, so listen to your body and don't hesitate to seek help when needed. Recognizing the signs of persistent itching is not only a simple way to reduce discomfort, but also plays an extremely important role in improving health outcomes and longevity, especially in seniors. According to research from the Journal of Gerontology, persistent itching symptoms can be associated with a number of serious health problems, from cardiovascular disease to dermatological and endocrine disorders. One of the common causes of itching in seniors is dry skin, according to dermatologist Dr. David B. Cohen. As we age, the body's ability to produce natural oils decreases, leading to dry and itchy skin. However, persistent itching does not stop at the skin. It can be a sign of a variety of underlying health problems, including diabetes, kidney failure, or even serious medical conditions like skin cancer. Research from the American Academy of Dermatology also shows that chronic itching can be a warning sign of some internal diseases. For example, itching in the abdomen can be related to liver or gallbladder problems, while itching in the legs can be a symptom of venous disease or circulatory disorders. In particular, when itching appears in vulnerable areas such as the skin under the arms, abdomen or back, the elderly should be especially vigilant, as this can be a sign of vascular or visceral diseases. Recognizing this sign as early as possible can help detect the disease at an early stage, when treatment measures are more effective. According to geriatricians, monitoring and controlling itching in the elderly can significantly reduce the risk of serious diseases, while helping to improve quality of life and prolong life. So don't ignore the itching, even if it may be mild at first. Pay attention to them and consult a doctor if this condition persists, as it may be a sign that your body needs timely and proper care. With the above information, we have understood that recognizing signs such as persistent itching can help detect potential health problems early. However, equally important is the role of lifestyle in determining the longevity and quality of life of the elderly. Although genetics play a certain role in our health and longevity, according to research from the World Health Organization, WHO, lifestyle factors have a much more profound influence. Lifestyle is a controllable factor, and studies have shown that older people who have a healthy lifestyle, including a reasonable diet, regular exercise and stress management, can live longer and healthier than those who do not pay attention to these habits. One of the important factors in lifestyle is regular health monitoring and care. This not only helps detect abnormalities in time but also helps prevent serious diseases from the early stages. For example, regular health checkups help doctors detect problems with blood pressure, blood sugar, or vitamin and mineral deficiencies, thereby adjusting diet and using medication appropriately. In addition, habits such as eating scientifically, limiting harmful foods, maintaining a reasonable weight and exercising regularly also help improve cardiovascular function, reduce the risk of diabetes, cancer and age-related diseases. Gentle exercise, such as walking, yoga or swimming, is not only good for physical health but also has a great effect on mental health, helping to reduce stress and improve mood. However, an indispensable factor in maintaining health is maintaining and improving mental health. Good social relationships, healthy hobbies, and maintaining a positive attitude in life will contribute significantly to longevity and maintaining good health. Persistent itching is not always a symptom of common problems. In particular, if the itching persists for no apparent reason, it can be a sign of serious diseases, including cancer. One of the cancers associated with itching is lymphoma, a type of cancer that affects the lymphatic system. Older people, with weaker immune systems, are more likely to experience symptoms such as persistent itching and unexplained weight loss, and this should be closely monitored. Mr. John, 62 years old, has felt persistent itching in areas such as his abdomen and back for several months, along with sudden weight loss for no apparent reason. Initially, he thought this was just a symptom of aging or a side effect of some of the medications he was taking. However, after going to the doctor and having tests done, he was diagnosed with lymphoma. His story is a prime example that persistent itching should not be ignored, but should be checked out by a doctor immediately to detect serious underlying problems. Itching can be a symptom of many different health conditions, but if it is accompanied by signs such as weight loss, fatigue, or swollen lymph nodes, it can be a sign of lymphoma or other cancers. Therefore, careful health monitoring and regular checkups are very important, especially for the elderly. Therefore, when itching appears with these symptoms, we need to pay special attention and learn more about the underlying cause. Information about lymphoma is really important and can help us better understand one of the potential causes of persistent itching. Lymphoma is a type of cancer of the lymphocytes, and the lymphocytes in the body can secrete histamine, a substance that causes itching. About 20% of people with lymphoma will experience itching, and this usually appears suddenly, is not relieved by medication, and is not accompanied by a rash or changes in weather like normal itching. So, if you or a loved one experiences unexplained, persistent itching, don't be subjective and go see a doctor promptly. In addition to itching, lymphoma can also be accompanied by other symptoms such as enlarged lymph nodes, low-grade fever, night sweats, unexplained weight loss, and anemia. These symptoms can be easily overlooked or confused with other health problems. However, if we are aware and pay attention to these signs early, we can detect the disease at an early stage and increase the chance of effective treatment. Sometimes, unclear symptoms will make us feel worried, but it is important not to ignore them and need to go for a health check for an accurate diagnosis. Timely health care will help you maintain a healthy and peaceful life in your old age. While itching can be a sign of many serious conditions such as lymphoma, there are also other causes that need to be noted, one of which is diabetes. Itchy armpits, one of the most common areas of itching, can occur when diabetes affects the nerves and skin. This is especially common in people with diabetes, and it can also be aggravated when factors such as being overweight and sweating lead to the growth of bacteria and fungi. Itchy armpits can be a warning sign of your health condition, and one of the most common causes is diabetes. Diabetes, especially when not well controlled, can cause an imbalance in the nerves and the skin, leading to persistent itching, especially in areas that are prone to irritation, such as the armpits. This occurs when the nerves in the skin no longer function as they should, making the skin more sensitive and prone to itching. In addition, people who are overweight often have this condition worse because they sweat more, creating a moist environment that is favorable for bacteria and fungi to grow. The growth of these bacteria and fungi can make armpit itching worse, accompanied by discomfort and even dermatitis. Therefore, proper skin care and diabetes control are very important to minimize itching symptoms. To effectively treat armpit itching, you need to pay attention to keeping this area dry and clean, using mild deodorants and avoiding irritating soaps or products. In addition, controlling blood sugar levels with a healthy diet and regular exercise will help reduce itching symptoms, bringing you comfort. Taking care of your overall health, from controlling diabetes to skin care, will help you stay healthy and prevent these unpleasant health problems. Diabetes, as mentioned, can increase the risk of itching in many areas of the body, including the anal area. This is because diabetes can affect the nerves and lead to loss of sensation or itching in sensitive areas. However, anal itching can also be a sign of other serious conditions, such as hemorrhoids, anal fistulas, or even rectal or anal cancer. A real-life example could be the story of Mr. James, 65 years old, a long-term diabetic. He started to feel itching in the anal area after having poor blood sugar control for a long time. When the itching became severe, Mr. James went to see a doctor and found out that in addition to diabetes, he also had hemorrhoids. The doctor explained that the stress in the body due to diabetes combined with an unhealthy diet had created this condition. Importantly, when anal itching occurs, it is not always related to a minor problem but can be a sign of serious conditions that need timely treatment. Anal itching can be caused by conditions such as hemorrhoids, which are caused by pressure on the veins in this area, or anal fistulas, a condition that is often accompanied by infection and inflammation. In more serious cases, it can also be a sign of rectal or anal cancer. Therefore, if you or a loved one experiences persistent anal itching, it is important to seek prompt medical attention to treat the root cause and prevent dangerous complications. Similar to anal itching, genital itching can also be a symptom of many health problems, especially in women. However, itching in this sensitive area can be caused by gynecological diseases, such as vaginitis or genital warts, and if not diagnosed and treated promptly, this condition can lead to serious complications. A typical example is the story of Maria, 45 years old, a married woman with 2 children. She started feeling itchy and uncomfortable in her genital area after a long trip, when she didn't have a chance to clean herself properly in humid conditions. At first, she thought it was a common skin irritation. However, when the symptoms did not improve and were accompanied by other signs such as pain during intercourse and a foul odor, she decided to see a doctor. After examination, the doctor diagnosed her with vaginitis due to a yeast infection and needed antibiotic and antifungal treatment to resolve the problem. Genital itching in women can be caused by a variety of things, from fungal and bacterial infections to sexually transmitted diseases such as genital warts, caused by the HPV virus. Sometimes, itching can also stem from hormonal changes in the body, especially in women during menopause or after giving birth. Therefore, when experiencing genital itching, it is very important to have a professional examination and diagnosis to determine the correct cause and treat it promptly, avoiding unwanted complications. When we talk about itching, a little noticed but extremely important cause is hypothyroidism. Hypothyroidism occurs when the thyroid gland does not produce enough hormones needed to regulate important functions in the body. One of the typical symptoms of hypothyroidism is dry skin and itching, especially in the lower legs, where the skin is thinner and more susceptible. In the fall and winter, when the air becomes dry, the itching can become worse, causing discomfort and affecting the quality of life. For example, the case of Ms. Linda, 68 years old, a patient with a history of hypothyroidism. Although she has been treated for a long time, every fall, she feels itchy in her lower legs and other dry skin areas. At first, she thought it was just a normal dry skin condition, but when the itching persisted and became severe, she decided to see a doctor. After testing, it was confirmed that her itching was related to hypothyroidism and dry skin, and the doctor adjusted her thyroid hormone treatment and recommended using a moisturizer to improve her skin condition. However, itching is not always related to dry skin. There are 2 main types of itching that we need to distinguish: dry itching and moist itching. Dry itching is common in the elderly, especially due to the natural aging of the skin. As we age, the skin becomes thinner and loses moisture, leading to itching. In contrast, moist itching can be related to more serious health problems, such as impaired liver or kidney function, or other diseases, if the itching is accompanied by symptoms such as fatigue, swelling, or changes in skin color. It may be a sign of an underlying health problem and should be thoroughly examined. Whether it is dry itch or moist itch, identifying the cause and treating it properly is important to avoid future health problems. Persistent itching is not only an uncomfortable symptom, but it can also have a major impact on the health of our skin. When itching persists, especially if it is not treated properly, it affects the skin's ability to retain moisture. The skin can become dry, rough, and lose its natural protective layer. This increases the risk of bacterial or fungal infections, as the skin's protective layer has been weakened. In fact, if itching is not addressed promptly, conditions such as dermatitis, eczema, or other serious skin diseases can develop, making it difficult to treat and restore the skin. For example, Ms. Nancy, 72 years old, is an elderly patient with persistent itching on her lower legs that cannot be clearly explained. At first, she thought it was just a sign of normal skin aging. However, when the itching persisted and small cracks began to appear on her skin, she decided to see a doctor. After examination, the doctor discovered that she had a thyroid hormone deficiency, which led to dry skin and persistent itching. In addition, due to lack of timely care, her itchy skin became infected. Timely treatment not only helped her relieve the itching but also restored her skin, preventing more serious complications. From the perspective of traditional medicine, dry itching often occurs in the elderly due to the decline in the function of sweat glands and sebaceous glands, causing the skin to no longer have enough natural moisture. Elderly people are more susceptible to this condition, especially in winter when the skin is prone to dryness. In addition, moist itching, which is often accompanied by discharge, can be a sign of serious internal problems, such as liver or kidney dysfunction or digestive system diseases. If not treated properly, moist itching can lead to secondary infections, making the condition worse and making long-term treatment difficult. Therefore, if you or a loved one experiences persistent and unexplained itching, do not hesitate to see a doctor to determine the cause and have appropriate treatment, avoiding unwanted consequences for skin and body health. Scratching is a natural reaction when the body feels itchy, but it can cause serious harm to your skin and health. Scratching too hard or too often can damage the skin, increasing the risk of infection. Excessive scratching can also lead to changes in skin pigmentation, causing dark spots or melasma. In addition, in some cases, scratching can cause the skin to bleed and leave permanent scars. Therefore, proper control of itching and avoiding excessive scratching are essential to protect skin health. Based on medical research, maintaining skin moisture and controlling irritants play a very important role in reducing itching. Regular skin care by moisturizing helps keep the skin soft, reducing dryness and itching. In addition, avoiding exposure to irritants, such as harsh soaps, detergents with fragrances or chemicals, can also help reduce itching. Preventing dry itching is an important part of skin health care, especially for the elderly. Diet is an indispensable factor. Spicy, greasy foods should be avoided, as they can increase the level of inflammation in the body. Instead, add foods rich in manganese and vitamins, which help maintain healthy skin and the immune system. Certain foods such as green vegetables, whole grains, and fresh fruits can provide important nutrients for the skin. Proper skin management is also important. Getting enough sleep helps the body repair and regenerate skin cells, while also improving overall health. Washing your face with cold water and moisturizing regularly are also simple but effective ways to keep your skin from drying out and reduce itching. It is also important to reduce bathing during the cold season, as hot water can strip the skin of its natural moisture, causing dryness and itching. Finally, adjusting your living environment can also help prevent itching. Avoiding exposure to irritants such as dust, harsh chemicals, or excessive heat can reduce the risk of skin irritation. Proper care will help protect your skin from itching problems and maintain long-term health. When itching persists without a clear cause, the most important thing is not to be subjective but to see a doctor immediately to detect and treat the disease promptly. Specific itchy areas on the body, such as the armpits, anus, or calves, can be signs of serious health problems such as internal organ diseases, cancer, or other underlying diseases. Early detection of these signs can help save lives and improve the patient's quality of life. Don't forget that taking care of and monitoring your health is an important action to protect yourself, especially when we enter old age. Therefore, pay attention to small changes in your body and act promptly. If you find this information useful, don't hesitate to share your opinion under the article, comment or subscribe to the channel to receive more health knowledge, helping you and your loved ones stay healthy and live longer. Let's share and spread these important messages together.